Hello, welcome to Acu Show and Tell. I'm Tara Akuna. I'm a registered acupuncturist here in Ontario, Canada. And today joining me is Sara Ward, a registered acupuncturist in Vancouver, BC. Thanks for joining me today, Sara. It's nice to see you.
Yeah, nice to see you too. Thanks for having me back.
Yeah, definitely. And I think today you were going to bring a case to me, which seemed
Mhm,
more digestion focused, but there are some other
mhm.
components. Do you want to go ahead and tell me your case study?
Yeah, totally. So, female, yeah, I want to say like maybe 30s, mid 30s, maybe. Um, Kind of primarily came in because I have been treating her husband, and recently in practice, I'm noticing a little bit of a trend where if I can't shift something with someone, meeting their partner has been super beneficial, and especially bringing them into treatment together allows me to kind of like put a little loop around them, a little connection through them, and then also kind of get to know the energetics of the partner. With that, she comes in with neck and shoulder tension, jaw tension. Generally, she sleeps pretty well unless she is dog sitting, which is kind of a part-time job at the moment. Um, Digestively, recently trending a little bit more to constipation. Um, she has had history of looser stools. She called them the scaredy poops. Super cute. It's like the cutest thing I've ever heard. Um, but now they're a little bit more, like, yeah, like I said, tending to constipation. Bloating, not so much. She's a really tiny person. So not like visibly distended or puffy or anything like that. Um, she has energy slumps in the day. Um, she has a tendency towards apathy and low mood if she's not really on top of her meditation practice. Um, she her biggest thing is like she feels a little compassless at the moment, uncertain with a lot of change and careers and where things are going.
So without direction.
Yeah, like really lacking direction, motivation, those types of things, really uncertain where to go.
Did she give you
Um,
any indication if she feels stuck, or is it just lack of direction?
I would, I w- would wager stuckness. Yes.
Okay.
Yeah, because everything seems a little bit stuck. So she kept pointing to her neck and chest, specifically her red meridian and very much her throat, which then
Ah,
tied into her a little bit of childhood trauma
yeah.
that she kind of talked a little bit about, and not being able to like kind of speak her truth or speak her mind to and with her family. Gynecologically, periods are regular now. She has had her left ovary removed, and she described it as icky energy.
Mm.
When she had that removed, she's like, it was just like an icky sensation. She has several cysts on the right ovary. Periods are like darker blood, some clots. Every so often, she'll have a really horrible period where like vomiting and doubled over. Um, she said maybe like once or twice a year. She couldn't really correlate reasons why that would happen. Her tongue was like puffy, purple, reddish on the sides and tips.
So at first, when you told me, I thought it was a bit more digestion focused. And I know that's the way that you sort of went with it, but the more
Mm-hmm.
that you told gave me the bigger picture of her symptoms, I felt like doing like a Maj 12, which
Mm-hmm.
in the balance method is kind of like a reset for all the meridians. You touch on every single meridian in the body for people who don't know. So I think I'm gonna go with my gut and stay with the Maj 12, especially like with the symptoms that are like happening in her throat. And then she has some gynecological symptoms as well as digestive symptoms. So I'm going to share my points. What I would do is start with Anmian, which is yin tong, and then in the ears it's Shenmin, and then Anmian behind the ear, and that's on both sides. And then for the body, I'm going to do heart 9, pericardium 9, lung 11, and then on this leg on the same side, I'm going to do gallbladder 34. bladder 40, and stomach 36, and that's going to address a bit more digestion. On the opposite side, on her arm or her hand, I'm going to do large intestine 4, Sanjiao 3, and small 3. And then on her leg, on that same side, I'm going to do spleen 6, kidney 7, and liver 5, which I think is also going to kind of address some of the throat stuff as well. And the spleen 6 will be good for her period. And just kind of start there and see what shifts. And then I can narrow in as just some of those, see what's like remaining or kind of pops up more.
Do you know that type of person where you're kind of like, okay, I have to hit all 12 meridians?
Yeah. Yeah.
To me, that's like a classic treatment when if I don't know where to start with someone, start with
Yeah.
all 12.
And you can't like when we worked together, you coined a really good term. You called it a snow globe.
Mhm.
You
Yeah.
said that you were going to snow globe them. And
Mhm.
can you give me the little snow globe spiel?
Yeah. So it's how I explain acupuncture to people that have never had it before is like, I'm coming in and I'm going to snow globe you. So imagine yourself kind of standing in a snow globe. And what's happening is that your body, your like muscle memory, your cell memory, all of the things that happen on repeat for you, or if you're feeling stuck or whatever, um, fall in this the similar pattern all the time. So when you come and you're lying on my table or in my chair and I'm putting the needles in, what I'm doing is I'm asking that snow that keeps falling in that same pattern to change. So it feels like I've just gone in and like shaken everything up, and then I'm like, see ya. Yeah. So asking that muscle memory, cell memory to like fall on in a different pattern so we can elicit change, which is the ultimate of what we want in acupuncture. That is the reason people get acupuncture is because
Oh,
they're
good.
seeking change, right? So
Yeah.
they get snow globed, which I love, right? Like I love to get snow globe. I love to
It's
get
such a
snow
good
globed
a
and
visual, right? Because you can
yeah.
imagine how the snow is gonna, it has to go in a new pattern. It can't go back the way it was. And that's what just
Mm-hmm.
happened.
Yeah,
And
it's like turning on the lights in the snow globe, right? You turn on the lights and now it looks like the snow is falling in different places, but
yeah,
with acupuncture it actually is. So,
yeah. So
mhm.
what was the approach that you used with her?
So with her, I actually used the Earth School method with her, and I'm currently learning this with Yvonne Farrell, and it's called like a syndrome. It's something that I don't even know if we were necessarily taught in school a lot. Anyways, it's basically about rejigging the snow globe, right? The transportation and transformation of chi. That's basically what we're doing again. So it's like, so this is like a stripped down version of a Maj 12. Really focusing kind of like on the core. So the points I used are on the left side, stomach 43, on the right side, large 4, on the right side, kidney 2, left side, spleen 8, right side, kidney 10, and left side, small 5. So this is a really powerful treatment to help clear sludge, move, just to move goo. Like imagine if you were the snow globe and it's gooey in there, right?
Mhm. Yeah.
So we are trying to like stimulate that transformation and transportation of chi. So those are the points that I used. And when I came back to pull her points, I think maybe 45 minutes later, she's like, what just happened? I was like, "Are you okay?" And she's like, yes. And I'm like, "Can you tell me what happened while you were lying here?" And for the first little bit, I was so scared. She's like, all my attention was in my neck and throat, and like she was instantly like the moment I left her, she was instantly brought back to a moment in her childhood um with her parents that was like maybe the origin story of her like clamming up type of thing.
Ah.
um so when she told me that I was like, oh. I wasn't sure I was going to be unlocking that, but sure enough. And she's like, and so she's like, it made me cry. She went through all the emotions, and then she's like, and I'm like, did you use your meditation? Because I asked her to really use her meditation
Yeah.
while she was lying there, and she's like, once I could move past the fear and she brought the meditation in, she's like, all of a sudden it just transformed and this just opened right up, and she knew she kind of knew what she had to do next. And I was like, oh, cool.
Wow.
I'm like, okay, cool.
That's
Um,
amazing.
yeah, so really cool
Yeah,
because, as much as she is there to support her partner, she has her own journey to go through too. So
of
it
course.
was really cool.
Yeah, that's awesome. Well,
Hmm.
there you go. We have two acupuncturists with one case and giving two different treatments. If you have anybody similar that you're seeing, try those points out and see how it goes. We'd love to hear what your experience is. And I just want to thank you again, Sara, for coming on the show. I really appreciate it. And if you do want to see Sara, she is working in Vancouver. I will post her clinic information below so you could book in with her and her space that she owns.
I
And
love it.
have a great
Thank
day.
you.
Welcome.
All right, bye.
Bye.